This is Crystal Fenn with MedPage Today.
Bonnie Winston tastes good.
The major U.S. tobacco companies settled litigation with the states over advertising and marketing of tobacco to children in 1998. That landmark master settlement agreement has brought a windfall of cash to states, but not as much of the money has gone toward anti-smoking programs and cancer research as originally hoped. To find out where the money has gone, I spoke with anti-tobacco researcher and advocate Dr. Stanton Glantz, director of the UCSF Center for Tobacco Control Research and Education.
In the master settlement agreement, the big cigarette companies agreed to stop their most blatant marketing of cigarettes to kids, to get rid of billboards, to accept some restrictions on their sports sponsorship and things like that. And they also agreed to reimburse the states indefinitely for the smoking-induced costs that the states were bearing due to the fact that smokers got sick and state Medicaid programs and other state programs had to pay for it. The formula for the state payments is complicated. It depends on what the states are spending on Medicaid. It depends on how much smoking is going down. It depends on when in the process the different states entered the litigation. But over the first 25 years, it's been estimated to amount to about $250 billion, and that would then continue indefinitely.
With that money flowing in, the states have had some choices to make.
The money that went to the states was just cash. There was no way legally that the attorney generals could sign an agreement that obligated the states to spend the money in any specific way. That's a function of the state legislature under the state constitutions. But there was a strong expectation that a sizable fraction of the money would go for anti-smoking efforts. And indeed, many of the attorney generals pushed for that, and many of them got it. And during the late 1990s and for the first part of the 2000s, many states had very, very large, aggressive, and quite successful tobacco control programs. And you saw the effect of those programs in big reductions in youth smoking, and also big reductions in adult smoking. Now, in the last few years, claiming budgetary exigencies or a whole lot of other excuses, pro-tobacco forces have really seriously eroded the money that the states are spending on their tobacco control efforts. And so now only a couple of the states are actually spending what the CDC recommends they spend. And many of the programs have been shut down entirely. And if you look around, in some states they're using it to build highways, in other states they're using it to cut property taxes, in other states they're using it for college scholarships or to build hospitals, in some places they're putting it into biotech research.
But moving that money away from anti-smoking programs is counterproductive, according to Glantz.
The depressed economy is the excuse for cutting these programs. If you look at the economics of them, and that's something we've actually studied, these anti-smoking programs pay gigantic dividends to the state in the short term. California's had a large-scale anti-smoking program going since 1989-1990 that was put in place by a voter initiative. And we found that within a year and a half of the program starting, you started to see healthcare costs dropping below what you would have expected. That was largely because of fewer heart attacks, fewer asthma attacks, and hospitalizations for respiratory conditions in the short run. And then over a period of 3 or 4 years, you actually started to see less cancer, too. And over the first 14 years of the program, it cost the state a total of about $1.5 billion. It saved $86 billion in healthcare costs. Here in California, where we have a chronic budget deficit now, the state's budget deficit would probably be $3 or $4 billion higher absent the anti-smoking program, because a sizable fraction of these health costs are paid directly by the states and the federal government. So the whole argument that the states can't afford these programs is just purely fallacious. A lot of the other money being spent to build roads or college scholarships or things like that, I think those are all perfectly fine things. But and in fact, there's enough money in the master settlement agreement that if all of the states were to fund at the levels that the CDC recommends to have maximally effective programs, there would still be tons of money left over for other things. In fact, there would be more money left over because the cigarette smoking was pushed down the cost to the states of state Medicaid programs and other state health programs of paying for all the excess heart attacks, pulmonary problems, asthma, child health problems that smoking causes would be eliminated, and that money would be freed up for other purposes.
Even if the money hasn't gone quite where expected, the legacy of the master settlement has been positive.
The master settlement agreement has done a lot of good things. First of all, while the restrictions on tobacco marketing that are in there have some loopholes in them, we have seen the end of billboards. We've seen a dramatic reduction in sports events and other kinds of tobacco sponsorship. It's become harder for the big companies to directly chase after kids and do marketing campaigns that are obviously directed at teenagers. Now they've shifted and really put a huge amount of effort into getting young adults, and if they can get young adults to smoke, that sort of spills down to the teenagers. But at least we don't have anything that's just blatantly appealing to teenagers. The reductions that we've achieved because of the state programs funded by the Master Settlement Agreement are huge and real and have a current and long-lasting effect on public health. That's a good thing. Another good thing that's very important is these programs have demonstrated that we actually can rapidly reduce tobacco use. 10, 15 years ago, if you'd have come to me and said, do you think we could eliminate tobacco as a public health problem in 5 years? I would have said, you're nuts. We don't have the clue how to do that. Well, today I think that's possible.
So states have shifted their share of the master settlement funds away from tobacco control, especially over the past few years. But whether that has actually helped control budget shortfalls isn't clear. This is Crystal Fend, MedPage Today.